Hey, it's Dr. Dunaway here with Chiro Strength, and today we're going to talk about the kettlebell armbar and different variations of it to really work it good into a prehab or rehab program. Now, like always, none of this information is meant to be diagnostic in any way. So this does not replace a good medical assessment and opinion. If you have any issues with it, any pain, or you don't feel comfortable with it, make sure that you get that professional advice and guidance before you start anything like this. But the kettlebell armbar, great for shoulder stability, great for thoracic rotation. It's kind of killing 2 or 3 birds with one stone. So if done right, this is a really powerful drill, and it always, in a prehab rehab setting, is going to double as a breathing drill. So good slow breathing through the diaphragm, really kind of getting that expansion of the abdomen as you're breathing, and don't really think about too much of set reps or anything like that, but really focus on a time of breathing properly and getting this work in. So first thing, just in general, when you're holding a kettlebell, we don't want the wrist bent like this. I'm going to have you start with your fingers pointed towards the ceiling. That kettlebell is going to rest right here, and you're going to grab that kettlebell with the wrist in line with the forearm and not cocked like this. So the first thing to a kettlebell armbar, we're going to get into what looks like a Turkish get up position. So again, fingers pointing to the ceiling. I'm going to grab right here so the bell is resting on the back of my wrist and my wrist isn't cocked back. My arm's going to go above my head. I'm going to push off this leg, push the kettlebell towards the ceiling, and get to a point to where I'm nice and comfortable. I can, again, use this arm to support my head. My shoulders are stacked right underneath my hand right here. And what you'll see is a lot of people, when they get in this position and they're not used to being in this position, you'll see this kind of shaking. If you're shaking like this, get a lighter bell or get a lighter weight. Now I'm going to slowly start to do some external rotation and breathe. I'm going to slowly start to do some internal rotation and breathe, keeping my shoulders stacked right underneath my hand. A lot of times what you see people not get all the way over, and so now I'm kind of in this position to where I'm laid out almost like I'm trying to do a thoracic rotation drill. But the thoracic rotation comes from once you're stable here, so I do this for about 30 seconds or so. Once I get stable here, I'm going to let this leg right here, my support leg that I brought over, I'm going to start straightening that out and bringing my pelvis down towards the ground. And now I'm getting a real good thoracic rotation drill here. So now my shoulders are not underneath this bell, and I'm getting a little bit more mobility. And it's really requiring a lot of stability in a weird kind of odd in-range position for the shoulder girdle. And so again, having someone to support you is really important here. Don't go too heavy. This is why we're using a lighter bell. Breathe and come out of it that way. So that was the arm bar with a little bit of thoracic rotation here. And now we can do what's called a crooked arm bar. So now again, let's say that we feel nice and stable with the normal arm bar. We're able to kind of get a little bit of rotation here, and we don't feel like our shoulders in any compromised position. What we're going to do is we're going to turn our palm towards our face here. So now my palm is facing over my head, and I'm going to bend my elbow down towards my waist. My forearm stays completely vertical here, right? So this is what's called a bent arm bar or a crooked arm bar position. Now the same thing with a crooked arm bar. Nice good breathing pattern here, here. Now this requires a lot of prerequisite external rotation of the shoulder. So this is both a really good mobility drill for the shoulder and again thoracic spine, as well as good stability. And we're going to hold this for about 30 seconds again, doing a little internal external rotation, breathing, and then I'll either come out of it like this, or if you don't feel coming out of it, you can slowly start to rotate over to right here. So that bent arm bar position, what it is pretty much in this position here. So if you can't get this external rotation to where this wrist would be vertical and you're here, that's not going to be good. You really need to have that prerequisite range of motion here to do that kettlebell arm bar efficiently. And what that was I was laying on my side and I just pull my arm down towards my hip like this. And as I pull it down towards the hip, I have that kind of just resting on my hip bone or a little bit behind if I want to get a little extra range of motion in that shoulder. And again, we're just holding that and breathing and making sure we do it slow enough as far as progressing from the kettlebell armbar to the crooked armbar to really allow for the mobility and stability to be there. And so we're not trying to advance that too quickly and putting too much stress on either the capsule, the biceps, or the rotator cuff. So Those are two good variations of the arm bar and the crooked arm bar. Now let's take a real quick look at a bottoms up position that we can do. So the bottoms up position here, we're going to get what would be in the arm bar position, but all we're going to do is we're going to hold the bell bottoms up, right? And the same thing applies. The wrist needs to be in line with the forearm so it's not crooked and bent back. So if we hold that good position, we should be able to support this nice and steady. And again, we're not using a heavy bell. External rotation, internal rotation. So I'll call this a corkscrew. And again, we just spend about 30 seconds doing internal, external rotation, making sure we don't have too much shaking. And then what I'll do is, if I'm good with that, I'll do a little protraction. So pushing the bottom of the bell as far toward the single as I can. And then get a little external, internal rotation from that point. Again, remember this is all a breathing pattern here. So keep a good breathing pattern because it's just as much of a breathing exercise as it is a shoulder stability and mobility exercise. And I'll retract and bring that shoulder blade down towards the ground. Get the same external, internal rotation. So that corkscrew is a good kind of variation of that as well to really challenge that stability. Now the last thing I'm going to do is a drill that kind of is at the back end of a rehab protocol or in a good finisher for a prehab program, meaning at the end of a shoulder workout or upper body workout. This is a really good way to condition the shoulder to be in various overhead positions because it's going to utilize a kettlebell in the first couple phases of the Turkish Get Up, and then one rep is going to be anywhere from 1 to 2 minutes long. And so what this is going to be is I'm going to get in a position, again, Turkish Get Up. I'm going to hold this start position for about 15 seconds. I'm going to come to the first position of the Turkish Get Up, hold for 15 seconds. Up, again, hold for 15 seconds. And then I'm going to come up into the bridge, hold for 15 seconds, down, 15 seconds, hold, 15 seconds, here, 15 seconds. And then if I want to, I'm going to, again, add the arm bar to that. Hold 15 seconds. Hold 15 seconds. And that would be one rep. So what you're trying to do is we usually don't condition the good overhead endurance, and because once we start running out of endurance, the stability mechanisms start to fail, and that's where injury can occur, especially towards the end of workout. So again, using a light kettlebell, making sure that those first couple phases of the Turkish Get Up are done properly. You're not shaking too much, again, is a great way to finish that workout. And all of these drills are a really good way to add to or start with a good rehab, prehab program. So if you have any questions, make sure you comment below. You can always reach me at drdunaway@chirostrength.com. I'm usually pretty quick about getting a reply out to you. Let me know if there's anything else you want to hear about. And like I always say, don't just mend, transcend. Thanks, guys.